afternoon, it's Ruta, the world's bench press champion, here on the School of Wellness on Aspen Weight Radio. And today I have a special guest with me, a family doctor who completed his GP training in 2006 and started his own clinic in 2017. He's a functional medicine doctor, and this is Michael Bazlinton. Hello, Michael.
Hi, Rita. Lovely to see you this afternoon. Are you well?
I am well. Thank you very much. And thank
Excellent.
you for coming to the show. It's really good to have you here.
Pleasure.
So let's start probably with you and your childhood, how it was when you grew up, and how you became a doctor, how you decided to become. So yeah, just tell me more about yourself.
Yes, I'm not sure because we met last week, didn't we? But we talked more about your results. We didn't really go into to my history much, but
No.
so the tables have turned. So I grew up in the south east of England, in North Essex, and in a little village. So probably of a couple of thousand people. So it was quite rural. My father was a dentist and in the local town, and my mother was a midwife, nurse. My grandfather was a GP on the south coast. So my parents met at, I think, Guy's, as it was then, medical school, dental school in London.
Mm-hmm.
And with my mother's father being a GP himself, so quite a sort of significant health background, I guess, if you like.
Mm-hmm.
So brought up by clinicians.
Yeah. So I guess that's what you saw all your life, wasn't it?
It was, but mum, I had two brothers and a sister, so there were 4 siblings. So mum was full-time hands-on mum at home. And so she wasn't working when we were growing up.
Mm-hmm.
Apart from, she used to do a few night shifts, but she was mainly sort of full-time hands-on homemaker, mum, carer.
Okay, so have you decided yourself to be a doctor, or because you grew up in that environment, or was it?
No, yeah, I thought I wouldn't be a doctor, actually.
Mm-hmm.
I had no intention of doing that. And when I chose my A levels, I did physics, maths, and geography.
Mm-hmm.
And actually applied to do engineering. So I did general engineering at Cambridge University, took a gap year, worked for an oil field research firm,
Mm-hmm.
sort of as a sort of post A-level student, and worked in their research facility for a year.
Okay.
Went to university with the intention of doing an engineering degree. However, I think I'd begun to get sort of cold feet, if you like,
Mm-hmm.
just before sort of the summer before I went. And during that first term, I sort of started thinking, well, maybe I should have considered doing something more medically oriented. I think I was interested in how things work. And at 15, 16, when you choose your A level, you're still quite you're not as mature as you are. I think my view of the world changed quite a lot between the age of sort of 15 and 19.
Yeah.
And the year working in industry, certainly I'd left school working with other colleagues, and I think I'd realized that I was more interested in people than I'd previously realized.
Okay.
And I think as a 15, 16-year-old teenager choosing your A levels, when I was at that time, I wasn't as interested in people and how people work as I was when I was sort of 18, 19. And I think I did a 2-month project in Portugal with a team of young people over that summer before I went to university. And one of the girls on the team was a medic. One was a radiologist. So just listening to them talk about their courses and their degrees and what they were doing and their sort of interest and passion. And I went into my first term of engineering thinking, I'm not sure I should be doing this.
Okay. It's boring, isn't it?
Yeah. So that wasn't, and I realized that the way the sort of fee structures work in the UK, that to do a 4-year engineering degree, then to go and change it, you can't you couldn't then really go on and do medicine. Well, you could, but you'd be talking, 10 years in education.
Mm-hmm.
And for what? So I then left. I
Mm-hmm.
left the course at the Christmas and had to do A-level chemistry because that's a requisite for medicine.
Okay.
So I reapplied to do medicine at a different university. I think I applied to Leeds, Bristol, Sheffield, and Southampton maybe. Whilst I was teaching myself A-level chemistry, and then I went to a crammer college for sort of 3-4 months and sat chemistry A-level in that summer. Passed, got a place at Leeds University, went to medical school, and pretty happy. I think it was the right decision. Certainly at the time, it was the right decision.
Okay, so do you feel happy now? What you achieved? I mean, how long did it take for you to graduate and become a doctor?
So I had 2 years out, essentially, 1 year working in industry, 1 year doing my A-level chemistry, changing my mind, and then 5 years of medical school. So it was 7 years from finishing A-levels to coming out the other end as what you call a pre-registration house officer. So you work for a year in hospital, being paid as a sort of very, very junior doctor, but you're not fully certified. And then you finish that year and you get your registration with the GMC as a independent practitioner, and then you start your training.
Okay.
So it was 5 years plus the 2 gap years plus the pre-registration years, so 5, 7, 8 years, and then I started my GP training. And I'm happy. I think anything like medicine is fraught with bureaucratic frustrations. But as a training, it's a privilege. A lot of the cost of the training at the time was paid for by the taxpayer. It's yes. I mean, we had some fees, but compared to medical students now who carry a lot more of their own costs, it was paid for. Patients sort of allow you to not practice on them, but almost, as a medical student, as a junior doctor, you are the junior on the team, and you're sort of people are willing to work with you to help you train. So having had that sort of background in physics, maths, and physical engineering, if you like, then to move across to more biological sciences, I feel that my perspective of the world is quite balanced. So it has the sort of quite physics, mathematic background, logical thinking, plus the sort of more the humanities. What's the purpose of life? Why do we live? How do we live? What's important to us? What makes us sad? And what makes us happy? What drives us? And that's and the biological sciences of why biology works. The sort of the mechanics of the biochemistry and the physiology.
Okay, so it makes you happy, basically, knowing how people work and helping them.
I think I'm glad I had the mathematical back, and I think this is we'll come on to, won't we? But functional medicine is about root cause and why things work, and going beyond. But the problem with there's a lot to fit into a 5-year medical degree, and so a lot of the work is learning, almost rote learning. So you learn by rote rather than by learning by first principles. Why does something happen the way it does? Well, we haven't got time to teach you that. You just got to accept that it does. Whereas sort of the physics and maths background is more about, what are the very fundamental basics? Why do things work the way they do?
Yeah. So
I like to ask why.
Right.
And it's so I feel that coming from a slightly different background to a lot of my other colleagues on the course, that was definitely an advantage. I mean, it took a little bit longer, but I definitely felt that it enabled me to have a sort of broader perspective of why things function the way they do.
Right, okay. So how did you find your first years then in working as GP when you qualified? So how did it go, and were you happy at that time? Obviously, you set up your own clinic, and you work as functional medicine doctor. And what was the decision to move to that, and to have your own clinic? So were any frustrations? Just tell me more about it.
Yeah, so I think so as I said, I brought up, my parents were very health conscious in terms of, they wanted us as children to live a healthy life, if you like. And my father was a dentist, and he saw the importance of nutrition in people's diet, the way it affects their dentition and their gum health and their teeth. So, and he was very pro sort of preventative dental care. So making sure you take care of your teeth and prevent, not eating sugar. And I remember, so although I wasn't at that time at sort of 13, 14, 15, I wasn't thinking I'm going to be a doctor or a clinician. I was interested in health. So we used to do lots of cycling, lots of road cycling, road racing as teenagers. My misspent youth cycling around the countryside. But so I was keen on nutrition, and I think I did a GCSE project on antioxidant vitamins like vitamin E and vitamin C. So I was interested in nutrition at that time. And I think when I went to medical school, I thought medicine was like engineering for people.
Okay.
So I thought that I would go and be taught how people work and how to mend people when they get broken. But unfortunately, it wasn't really like that. It was more about recipes. So if you find someone who has X, Y, and Z, we treat them with B.
Okay.
And if they don't tolerate B, we treat them with A. And you say, well, why do we do that? And they're like, well, we just do.
Right.
So it's a bit of an oversimplification. But unfortunately, I think that's where we're at. We've forgotten first principles. And I think the pharmaceutical industry have cleverly, by intention or not, sort of created a generation of doctors who work. It's a bit like coloring by numbers. So I mean, and that's I don't want to be dismissive of my colleagues, and there is a place for that, but it's if this person has this symptom and they have that symptom, well, we color them with this thing. And if they don't get better, we just shrug our shoulders and say sorry, we don't know. And I think it dawned on me that's what medicine was going to be like. I think possibly had I not had quite bad hand dermatitis, I might have chosen to go into surgery, where I think there is more, someone has an infected gallbladder and you take it out. Someone has an infected appendix and you take it out and you save their life. Someone's got an osteoarthritic hip and you put a new hip in. So in some ways, that side of the sort of surgical interventional side of modern medicine is very effective. But that probably would have suited my sort of engineering background and wanting to fix people in an engineering sense. But unfortunately, I get very horrendous dermatitis. So all the scrubbing up for theatre would just wreck my hands. So as a medical student, you'd do a placement with a surgical firm and you'd be in theatre. But it became clear that the nature of my skin wasn't. I would never be able to be a surgeon. I just would be off sick with bad hands. So, so the alternative is more medical work, where you're looking at, and the options there are, one of the options is general practice. And I think, at the time I knew that, I'd already sort of lost 2 years in a gap year. I was keen to sort of, general practice training is shorter. So if you go on a general practice training scheme, you'll probably be finished within 3 to 4 years. And at the time, the contractual sort of requirements of GPs had changed. So weekend work was optional, and it was more compatible with a family life. So I was attracted to that, and also the generalness. You didn't have to focus and become a specialist in one area of the body.
Right.
So if you train to be a gastroenterologist, your focus is on the gut. And obviously it's a complicated organ in its own right, but you're not going to be treating people necessarily with skin conditions or with mental health problems or with cardiovascular problems. Whereas, and to me, that felt too narrow. And being a general practitioner where you actually look at the human body in its entirety and understand it as a system, that really appealed. So it was a shorter training. It was more compatible with a sort of work-life balance. And sort of from a kind of interest point of view, I was interested in people as the whole person rather than just an organ. So I was more interested in a person with a liver and a kidney and and lungs than their lungs on their own, if you like. And it felt to me that the specialties were quite focused, and they are, and increasingly so.
Okay, so you decided because of all that to become a functional medicine doctor. So because of that, I decided to do general practice. Right. Okay.
Family medicine. So did my 3-year training, and as a 3-year training scheme, you do 6 months in accident and emergency. You do 6 months working in pediatrics, general medicine, obstetrics and gynecology, and I did a bit of psychiatry as well. And then you do a year in general practice. So I came out of those 3 years as a GP and sort of must have been about 2006-07. And I probably worked then 10 years just doing family medicine as a GP in the UK, before I sort of realized that within that, the thing that I was interested in was functional medicine. And I would say functional medicine is in some ways general practice at its best. So that the two are very similar, in that they're both looking at the person as a whole. So I was already halfway there, I think, in my sort of thinking and understanding of how I practiced and what I did. And I think what took me to sort of creating my own, because you asked earlier, didn't you, about why I then created my own practice. And so perhaps it's helpful to understand so I'm still working in the NHS. So I still do 3 days a week in my general practice as a partner in North Nottinghamshire, doing general practice, seeing patients with coughs, colds, headaches, possible cancers, everything, foot pain, arm pain, anything that walks through the door, and working in the system as it is. So I still do that. As I said, in 2016, I was probably working 4.5 days a week in that system, maybe 4.5, 9 sessions. And at the time, I kind of realized that was it. I was at the place, I'd been doing the job for 10 years and got to a level of competency, if you like, where I felt very comfortable and felt I was doing the job well. And once you reach that in general practice, there is what do? Do you just carry on doing that for another 20, 30 years?
Yeah.
But you need to keep reinventing you need to find interest, I think you burn out if you don't constantly reinvent things that you're interested in. And sort of, so even then within general practice, people might find, a specialty within that. So they would do a day a week or half a day a week as a dermatologist, or some people focus on musculoskeletal problems, give joint injections. Some people get more involved in organizational structure and politics of the sort of healthcare system. Again, I didn't really want to, just this sort of adversity to specializing. And actually, I think what I wanted to become was a better generalist, so having a sort of a more detailed understanding of how all these different areas connect together.
Right.
And at the same time, we had, you realize that within a part, the way that we're structured as GPs, as partners, we work alongside each other, and you're working with other colleagues, and sometimes that goes well. sometimes it doesn't go quite so well. You don't get on with all the people all the time. And I realized that I think I wanted to do something more independent to that, I think. So I wanted a little bit more freedom to sort of spend less time in meetings trying to bring other people along with me in what I felt was where we needed to go.
Yeah.
And I also I think that around about that time, my father, again, who was now a retired or just retiring dentist, sent me a link to a podcast by Robert Luswig. I'll find, and it went sort of viral in 2016. And he's a pediatrician who works with children with metabolic problems, with obesity. And he did a series of lectures, and one particular lecture called The Bitter Truth. Here we go. So it's Robert Luswig, The Bitter Truth. I'm just looking it up on YouTube, but I think it must 2.4 million views. So it's a great presentation, and he argues the case for why sugar, and particularly I think in that lecture, fructose, which is a form of sugar, is so problematic in our current kind of Western diet. And it just, again, it drew me back to, I think I'd spent 10 years just getting to sort of come, a bit coloring by, painting by numbers, and actually getting good at that. And it works to a degree, and, getting to know my patients, getting established in a practice. It took me 10 years. And I'd reached this point where I thought, well, I've kind of reached, people keep coming back. They still seem as unwell as they did when they first started seeing me. They haven't lost weight. They're still as unhappy, sad, depressed. And they still have all the same problems. And even though I'm using the right medication, they just it doesn't seem to be changing their lives.
Okay.
And here was this guy, this professor of pediatric medicine, explaining why, my patients were struggling with, the things they were struggling with. And I thought this is proper root cause explanation of, on a biochemical, physiological level of why I'm seeing what I'm seeing in my day-to-day practice. So that was a real eye-open to me, and it was just it was a challenge really to sort of realize that. So I've just got a glass of water coming. Oh, across the table, thanks. So it was a real challenge to me to realize that with all the knowledge I'd just have gained over the last 10 years, there was still more to learn, if you like.
Okay.
And at the same time, I wanted to sort of have more independence in what I was doing. So, and just the way our sort of working lives were being structured by the bureaucracy, if you like, from above, it meant it was becoming increasingly difficult to do to work 4.5 days in general practice, where each session was becoming 6-7 hours long. So you're talking about 14-hour days, so sort of 4-5, if a session was 9 sessions each, 7 hours long. It's a long week. It's a long week.
A lot of hours. Yeah,
it's too much, and you just think, I can't do this for another 30 years. I'm just going. I will get mentally ill, and so I think as a group of us, we realized we needed to restructure the way we worked. And some of my colleagues were nearing retirement. They wanted to work less. I just wanted to do something differently. So I took that opportunity. That was the moment. Into 2017, we set up a limited company to provide, and at the time I wanted to provide, I think I hadn't really understood there was this whole developing area of sort of specialism, if you like, or generalism of functional medicine. What I wanted to do is I didn't want to just do private general practice, but what I wanted to do is offer people a way of measuring what they were doing in their lives, whether it be nutritional input or whether it be physical input or physical output, mental output, and try and help them reconstruct what they're doing to actually to be healthier and to get more out of life, really. So, and at the time, there were a few of the wearables that in 2017, so Garmin were making, obviously their sort of fitness watches. I don't know whether the Apple Watch was just coming out, and then there was another company, a Californian company called Jump, I think, who are doing these little wristbands that you could wear, and it measures your sleep, and so these little health trackers. And I just thought this is really interesting, because people would come to me and say, I'm not sleeping very well, doc. And I'd say, like, well, what do you mean? And I just, what you need is, because their perception of their sleep quality was not going to be precise, and we don't know how we sleep, and actually to have physical measurements would be useful. So and actually having a way of doing it without autonomously, without sort of having to write it down. And there was a company who work with sort of the construction industry, so who do night shifts, and trying to think of they had a little band and they predicted people's sleepiness. So long distance drivers, as I say, sort of high risk environments. So mid sort of 2015, 2016, 17, there was all these devices coming onto the market that I could see had a really useful sort of clinical application. And it brought me back to my sort of engineering, the physics and math, the data collection, and actually using data to understand to actually make a proper assessment of where people are with their physiology, and then using that combined with their sort of their subjective experience, you could actually triangulate that with them and help them understand, because sometimes people have the perception of poor sleep, but actually their sleep's not too bad. And you say, look, your sleep's not too bad. Well, why do I feel tired all the time, doc? Well, maybe we need to do a blood test. Maybe it's not your sleep, it's something in your blood. And then and so you can actually start to piece together the puzzle for people. And I wanted to do, and I could see that. And then around about the same time, I sort of got a little bit more involved in the low carb movement. I read a book called Born to Run by Christopher McDougall, and he wrote a sequel called Natural Born Runners. And in that book, or Natural Born, I'm just googling it for me. Natural
Born Heroes.
Natural Born Heroes. Have you read it?
No, but I've written down to read it. It's on my list to read.
Yeah, so Natural Born Heroes by Christopher McDougall. And in that, he mentions the sort of low carb movement with Professor Tim Noakes in South Africa. And because I'd read his original book, Natural Born Runners. Let me get this right. Is that right? Natural Born Runners. Or Natural Born Runners. Let me just check. Yes. No, Born to Run. Born to Run. So he's written several books. He's a great author. There was another, he's written a third book since, but his first book was Born to Run, Christopher McDougall. And my brother lent it to me. He was sort of ex-military doing lots of miles. And he said, look, Mike, you get foot pain when you run, you ought to read this book. And I did, change the way I ran, don't get foot pain when I run anymore. So that sort of revolutionized my perception of running and the purpose of it, and how we can run better. And then when the second book came out, I'll read that too. That was more about nutrition and long distance exertion mixed with a wartime story. It's a brilliant book, great book. Introduced me to the concept of, lower carbohydrates causing or being problematic with metabolic syndrome, which then tied into the Robert Luswig lecture about fructose and sugar. And then I signed up for a Banting course, which is essentially low carbohydrate, higher fats, run by Tim Noakes and John Proudfoot online in South Africa. So I could do it from the UK. So I think I did that in the summer of 2017, the year after we established the company.
Right.
So, and that was my sort of introduction to functional medicine and more nutritional work. So, so I was talking, so that sort of dovetailed in at that time, to the sort of, using actual data, so, and sort of expanded it more to the nutrition and actual carbohydrate quantities, protein, fats. And then from that, I sort of then discovered the sort of concept of functional medicine, the Institute of Functional Medicine, who are trying to bring all of this, and within that discipline, trying to look at the sort of root cause and the sort of the broader picture, why people feel ill and why they're not as healthy as they might be.
Okay, so basically functional medicine is finding the root causes rather than just treating the symptoms, isn't it?
Yeah, I mean, functional medicine I don't know, it's an interesting word that's been adopted. I'm not sure it's the best word. I mean, there's people use the word integrative medicine. So they're trying to integrate lots of different things, but functional medicine, I think functional medicine has come from the concept that things affect your function, but might not necessarily reflect a pathology. So someone with a migraine, okay, they may find the days they have their migraine, they may not function very well. They can't concentrate, they can't work so well, they feel unwell. But if you put them through an MRI scanner, you wouldn't necessarily find any pathology there. You wouldn't find a brain tumor. So they have functional symptoms their symptoms are real, but they're not based on a pathology. So, and the problem is the more sort of conventional medicine, painting by numbers, if you like, has run out, doesn't know what to do. It says, well, here's a medication, all the best. If you don't get better, sorry, we'll refer you to the neurologist who might try a few other medications. And you might get a bit better, but the person with the migraine says, well, I'm still getting these migraines, and I still feel rubbish and I can't work and I'm missing work. I'm worried about losing my job and, my relationship with my partner's breaking down and, they're awful. We said, well, at least you don't have a brain tumor. Isn't that good? And they're like, and that's because we've used up. We've come to the end of what we have to offer. Whereas functional medicine says, yeah, your function's been affected. This is real. Let's try and understand, what's causing those migraines. Something's not right, and let's have a look at your diet. Let's have a look at your nutrition. What's your sleep like? What's your stress levels like? How are you managing that? And if we manage those, can't promise, but maybe the migraines will get better. And it might be that if you go back into those stressful situations, the migraines come back, but at least you now know how to control them and avoid them. And and that's got to be better. And that's, as good as, it's almost a cure, isn't it? It's
So basically, when you look at all what could cause, at all those causes, what could cause the symptoms, you can cure or even reverse the illness as well, right?
Yeah. So if you look on, if you were to get to the bottom of my first page on the website, you'd read the definition from the Institute of Functional Medicine, which is as follows. So functional medicine uses the patient's story as a key tool for integrating diagnosis, signs and symptoms, and evidence of clinical imbalances into a comprehensive approach to improve the patient's environmental inputs and his or her physiological function. So it's a very long way of saying, you try and look at all things to understand what's causing the symptoms, and to try and particularly, it says to actually improve the patient's physiological function. So they function better. So they feel better. They don't feel unwell. And I think this is, as a traditional medicine, approach to things, that we're looking, your traditional doctors are looking for pathology. And if they can't find pathology, they're happy. They say, you don't have skin cancer. It's good. Or you don't have, you don't have a brain tumor, or you don't have a lung tumor. But the patient says, but I still don't feel very well. And they'll say, that seems a shame. Never mind. Whereas
that's true,
I think the general population think doctors are there to make them feel better. But that's not how we're trained. We're not trained to make people feel better.
No.
if people feel better and well and have more energy, we say, oh, that's good. That's a good side effect, if you like. But it's almost not our we're not trained to see that as our purpose.
Okay.
You know, someone comes in with shortness of breath and a cough. Well, have they got pneumonia? Have they got heart failure? Have they got lung cancer? Well, they haven't got any of those. Fine, great. But they feel terrible. Oh, that's a shame. What, you know, and I think in the general population, there's this perception that you go to the doctor to and the doctor will make you feel better, there is, yes, of course, we'd love to make everyone feel better, but there's this mismatch, I think, and I think functional medicine tries to address that and says, you're telling me that you don't feel right, and I'm going to take that really seriously, and I'm going to try and understand why that is. And that's my aim. That's why we're working together, to help you, you know, because you're telling me you don't feel so well, and that means that you've missed some time off work, which means your job's threatened, therefore your finances are threatened. So that's really serious for you, and that's not good for your health. So, and that might, you know, if we don't correct that, the extra stress might be a component to you getting cancer. But let's see if we can understand that for you, and in a sort of cost-effective, efficient way, help you feel better so you can get to work, do your job well, enjoy your job, not be at threat of losing it, maybe get a promotion, and feel well. And I think functional medicine is looking for that outcome. And it does it rather than trying to find a singular pathology or a singular cause. It accepts that life is far more complicated and chaotic than that. And it tries to see a pattern in the story of that individual to actually help us find a solution, or help the individual patient, clinician, client find a solution, often for themselves, that actually does make them feel better and solves the problem that is most pressing for them.
Okay. So you started when that functional medicine clinic, and you had some patients, and would you be able to tell a story where you helped, well, at least one story where you helped a person who came with all those problems, and from what you did, you solved the problem?
No, absolutely. Because we were talking about this last week, weren't we? And I've had a bit of time to think about this and how best to do it. And so my story, so we set the business up in 2016, got it incorporated, did it properly, got all the sort of finances aligned, bank accounts to action, and it's been a very slow and gradual kind of growth really over the last 5 and a bit years, obviously with COVID in between. I did some extra training and just trying to sort of understand what people needed. How do you we just talked about, you know, what we're trying to achieve. So the question is, how do you actually do that? And how do what are my skills? Where they best deployed, and how do we reach the people we want to reach? So I did a sort of extended 5-day course, of kind of introductory course to functional medicine with the Institute of Functional Medicine down in London, I think 2018 maybe, or it was the following year, or 19. And once you've done that course, it's an introduction, and plus the 10 years of general practice training, I felt ready to sort of start working with people. So I also did a business accelerator. So we sort of understanding sort of how to communicate with clients, get onto social media. So my first handful of clients came out as a result of that sort of business accelerator. I did in creating a website, and on that website I had a sort of 3-part video course, which I think has now been made redundant. It's a good first try, but so probably it's the sort of thing I'd want to do more of in the future. So a few clients came that way, and one of my first client came in through that. I think she was searching for some of her problems, and my name popped up, and she watched my video and was encouraged by that. So I've picked 3 clients who I want to sort of talk about their stories. I've asked them in the past whether they'd be happy to give testimonials, which they are, and they've all written to me with emails with kind of explaining how I've helped. So I won't mention their names or give details away which will identify them. But so these are true cases, but they're slightly anonymized just for the purpose of doing that. So one of my first clients was a lady who didn't live in the UK, but she used to live in Doncaster. So when she saw my name and saw Doncaster, I thought, oh, that's a connection I've got there. So the clinic's based in South Yorkshire, Bawtry, but at the time I was and still am exclusively working online. So she was interested in what I was doing and had heard a bit about functional medicine. She worked in the health sector herself, so had some clue as to what she needed. And she was suffering really. She was wanting to lose weight. She was suffering with brain fog, fatigue, anxiety, really health anxiety, worried about herself, her family. She'd get palpitations, and she'd had 2 or 3 hospital admissions with these palpitations. And so she was worried about that. And she was also concerned. And the other thing for her was an issue was that her own doctor, again, wasn't particularly interested. They'd excluded, dangerous arrhythmias of the heart. Fine. You'd have a pathology. Good luck. But I still feel tired. I still have these symptoms. What are you going to do? And we're like, well, not much. But so I think there was a sense that she didn't have that sort of reassurance from a clinician that everything was okay and what the plan was. And she knew half of it, but she needed that other side of it. And she knew probably that she needed some form of sort of support in terms of supplements, but the supplement market is so huge and varied. She didn't know where to start. And so what we did is we managed to get some of her blood tests. We did, because she wasn't in the UK, the blood testing was a challenge. So we kind of put together blood tests she'd had from her own doctor, and also some that we did managed to arrange privately. But again, it was hard work, but we got all those blood tests together. And that gave us a clue as to what the problems were. So some problems that she thought she might have, she didn't. So she was worried she had significant thyroid issues, and we really couldn't find any thyroid issues there. So it's like, great, again, no pathology. So although we are looking at the sort of root cause, we're still interested in pathology. We want to make sure there isn't any signs of cancer or disease or illness. I'm still doing all of that, but it's just I'm going that next step further and saying, when we don't find that, what's the cause? So we reassured her that there weren't underlying issues with the thyroid gland. What we did find is significant iron deficiency, which we can come on to later in more detail. And she struggled to tolerate normal iron because she knew she'd had a history of a little bit low iron, but when she'd had normal tablets, she hadn't tolerated them very well, caused stomach problems. So we had to sort of basically work on a sort of different iron regime to gradually, over sort of 18 months, 2 years, to bring her iron levels up to normal. We also looked at, she had some issues with sort of low B12. She tried to have a sort of lower carbohydrate diet, but she was anxious about increasing proteins and fats because she had heard that protein can hurt the kidneys. If you eat too much of it, you can't really. And she was worried about fats, but she needed reassurance that it was okay to eat healthy fats. So, and also she felt that she couldn't burn fat. She couldn't get into what we'd call ketosis, which is a state where if you restrict or reduce carbohydrates or exercise, the body uses fat as a fuel. And if you're trying to lose body fat, you do really need to sort of teach your body to burn fat. She really felt she couldn't do that. And because she was worried about heart palpitations, she didn't want to overly stress her heart by exercising. So we managed to, what we did is we got a continuous glucose monitor and got a blood kit to test the blood ketone levels. And then we got her to measure what she was eating for a period of time, not for a long period of time, but for a week or two, of how much fat and protein she was having. So I could understand the detail of the physiology. And there was one day she'd got her carbohydrates down to sort of below 30 grams, 25, and she was really pretty disciplined about it. And she went for a walk, and I think her ketones came back at 1.5, and she was delighted, that, and so she realized that she could do that, and it wasn't something that was an anomaly for her body, and the experience of feeling, she recognized that she felt a bit different, but she felt safe in that. So I think it was giving her the confidence to do the things that she thought she needed to do, and had kind of worked out herself, but with a bit of guidance. And so I just got an email from her last month, January, because I haven't been working with her probably for 18 months now, because she doesn't need it. So she says, so I'm just gonna, out of the blue, beginning of January, she said, "Hi Michael, I'm doing very well health wise. My immune system is good. I'm no longer picking up everything and going. And when I do get a cold, it seems to lift quickly. I don't have any palpitations or nighttime waking, no more dizzy spells or joint pain or any of the post-viral fatigue symptoms I used to have. I've normal levels of energy and probably back at work and managing everything needed for my role. I've been able to take up daily use of a rowing machine in the last 2 months, can manage long, steady workouts or shorter bursts with HIIT type training. Not sure if you remember, but I was really afraid of raising my heart rate. I do. Weight is still stable. I wish I could say it was down, but stable is good compared to where I always was." So I just, that to me is functional success, isn't it? She's back at work. She's and she would love to lose some more weight, but she hasn't. And in some way, I think she will. But so if we just measured that on one metric about weight loss, it would look like a failure.
Yeah.
But actually, I suspect if we measured her muscle mass and looked at her fat mass, I could almost guarantee that she's going to have more muscle, more active metabolic tissue, less fat. But she's functioning. She's not anxious. She's not waking. So real success. So my first client, if you like. So
yeah. That's really good. That's a good story. I mean, and especially getting email, like you say, it's really amazing feeling, because you helped somebody and she's feeling healthy now.
And it didn't always feel like that. It really, so I have to sort of, and I think, I can sometimes, when you're in the thick of it and the client's emailing you say, "I'm just no better. And, why am I taking all these supplements? And do I really need them?" And, I'm still no, and having the confidence to say, "Look, it's going to be okay. We'll get there." Yeah. And this isn't a simple equation. This is you're an individual. You've got your own unique personal needs. And we just need to be patient, and we will get there. Absolutely. So on a similar theme, I had another client who came off her own back. I think it was a sort of friend of a friend who recommended her. And she, similar sort of, very similar sort of history, quite stressed, would like to lose some weight. She's 46-year-old female, family, stressful neighbors. She'd done some research. She felt that she had some issues with something we call methylation, which is the way certain biochemical processes happen in the body around the way our sort of metabolize proteins. And she'd done some work around this and thought she was a poor methylator. And we did some genetic testing, and that confirmed that she probably was. And we were able to sort of support her with the right supplementation because of that, whilst dealing with, making sure the right amount of protein, exercise. And so this email, I've got an email from her. This is going back 2 years, so January 21. So I emailed and said, "How's it going? Anything to report?" And she said, "I was excited to let you know, but didn't want to bother you. The best thing of it all is the dermatitis on my face has completely cleared up." And I don't think I even remember that she even had dermatitis on her face, and because actually that wasn't her sort of primary issue. But clearly, for which we talked about, I mean, totally gone. I do think it was because of some of the B vitamin deficiencies causing this. I've had it on and off all my life, but constantly in the past 5 years. What else we say? And Yes, all been good. A week on supplements and feel great. I've had the energy to walk 4+ miles every day. Random pains all gone and sleeping better. No sweats or palpitations. Knowing how I should feel, I can't believe how much I've struggled, especially this last year. Really happy. Thank you. So again, it's interesting, isn't it, that it's both those clients have sort of almost been released to go and do exercises they kind of didn't feel they had the energy to do. And then that's a sort of virtuous cycle. Once they've done that, they feel better. Then they feel confident they can do more. And then on a similar sort of theme. So it's kind of three stories really, but linked in a similar way. And this is more recently. I think it was last March. I started working with this gent. This is a male, 67-year-old, so a little bit older, and he came to me through an organization and sort of, I suppose, colleague, if you like, called Prolongevity. So shout out to Prolongevity. Graham Phillips is the pharmacist who gave up drugs. So he has a program based down in the south online, where he helps people more focusing on nutrition, reversing diabetes, and he sometimes refers clients to me who he wants to have blood testing done. So I do a lot of his blood testing work and go into a little bit of a deeper dive for him. So this chap was kind of referred from Graham, and actually it's interesting, isn't it? Because when I first started this, I thought in 2017-18, when I did this Bazlinton course, I would be doing more work on nutrition, but actually what the business has become more sort of related on blood testing, because there's lots of people working on nutrition out there doing really good stuff, and it's quite time consuming. And what they need is the sort of data backup in the blood testing. And that's it's quite difficult to get with a clinician doctor who is willing to sort of put their name on the line and say, yeah, these bloods mean this. And so I've ended up doing more of the blood work than I have really the sort of nutritional work, because quite a few clients come from Graham, and so we've found a way of working with each other. So
that's good.
Yeah, and I think for the future, that's and that's when you contacted me, and I thought, wow, this is someone who does strength training, and this is a really good connection. You live in Doncaster, and because I'm always looking for people who I can kind of work with. I think there's enough people who need help out there. What we need to do is play to our strengths and be most good at what we do. And I so over the last 3 or 4 years, I've become more of I see lots of blood tests, which I love, because they're fascinating, and some more the nutritional work, let other people do that if needed. So we digress. But so this chap, 67-year-old male, came from Graham, and he didn't have any major issues he'd retired, was wanting to enjoy his retirement. He'd got some hobbies where he wanted to be fit and active, and he just felt a little bit tired, a little bit of lackluster, was waking in the night with urinary symptoms, and just not 100%. So we did some blood tests for him, and we got his weight, and so he had a raised PSA, borderline PSA prostate test, which can be a sign of cancer. So again, I said, look, because he was waking at night, I said, you need to go and get this checked out properly. You need to see a urologist. So his GP sorted all that out, and was very happy to do that. Good news, he doesn't have prostate cancer, probably just a slightly larger prostate than normal. And that's why he's got the symptoms. So, so yes, it's functional medicine. We're not necessarily expecting to cure the pathology, but we need to make sure that we're not missing pathology. So again, functional medicine it is scientific, conventional medicine plus something else, plus additional. So so, and then also he was quite underweight. So I said, look, you're not eating enough. You're not eating enough protein, you're not eating fat. You're trying to exercise on an empty tank, and your body mass is too low for your height. So unlike the two ladies we just had before who would like to lose some weight, we've got someone who needs to gain some weight. And I think actually with all those three people, they probably all need to gain muscular weight. So, and this is a huge issue with, particularly, not to generalize, but particularly women in their 40s and 50s who want to, they're not happy with their body composition. They want to lose weight. And if I can persuade them they need to gain, if they can turn their sort of thinking around for thinking of gains, then they will, if they can gain muscle weight, they will lose some of the body adipose tissue, and they'll feel better about themselves. But it's a mindset. And I think all three of them have, by doing more exercise, probably increased their muscle mass. But so this chap, so he, let's have a look. So this is an email from him in June. Again, he's more than happy for me he was going to write me a testimonial, but I haven't got around to doing it. Yeah. So here it is. So hi, Michael. Yes, finally got the PSA repeat test, which was taken in May, 6.7. Got an MRI appointment for the 19th of June. Postponed due to COVID-19. Rescheduled for the 4th of July. Anyway, we know that was all normal, so that was good. He said, okay, the weight up about 3 kilos. So he's telling me he's proud that he's put on 3 kilos, brackets, muscle mass. Have been getting in good training sessions up until last week, keeping on track with a higher protein and daily supplements, except for collagen drink, which I'm not keen on the taste. Fine. No issues with gout, because he was getting some gout. Sleeping better with much less urination disturbance. Generally feeling much stronger with much higher energy levels. Also back to running 5K. Overall going in the right direction. Best wishes. So I said, great, this all sounds good. So we had a little bit of chat about the collagen and how to sort of get over that. Happy to write a testimonial anytime. Having the energy level to train is a game changer, as well as getting a good night's sleep, waking up feeling well rested. Also, not getting the debilitating calf muscle soreness for 48 hours after a run. I'm nudging 76 kilos now, so well on the way to the 80 kilogram target. So, I'm not all about helping people lose weight. This is a case of someone who needs to gain weight, the right sort of weight. Also getting intrigued to see how the blood marker repeat is going to turn out in a few months' time, as I'm well on the way to feeling 10 years younger. Yes, have been following the collagen drink recipe precisely. Glycine, Creapure, collagen. And then he just emailed me last month, which jogged my memory. So this was January, or maybe just the beginning of this month. Hi, Michael. Happy New Year. Best wishes for 2023. It's been a while since we last communicated, so hope all well your end. From my side, I'm happy to report I continue to make positive progress. Slight setback 4 weeks before Christmas with a self-inflicted mountain bike injury, but now back running, cycling, weight training. Endurance, strength continue to improve, and weight is slowly trending up through muscle mass gains, hovering around 79 kilos. Typically eating 2 meals a day with protein around 120 grams. Sleep has improved and started having bouts of sleeping through the night from late December. I recently had a follow-up on the prostate situation and will send you a copy of the consultant's letter. I've decided to hold off taking the prescribed medication for the time being as my symptoms have improved. And I was thinking of, not thinking of doing that yet. So all really positive stuff. And again, it's interesting, isn't it? It's the energy and the ability to exercise that's changed for these 3 clients. And they didn't come to me and say, I want more energy, although the chap did, but the 2 ladies didn't come and say, I want more energy, I want to be able to train more. But that was the outcome. They were more functional in there. And the first lady we talked about, she, her job and her work situation is much better as a result too. So it's the whole picture that gets better. So 3 stories of people who have done really well.
Yeah, and it's amazing because when you look at that perspective, a lot of people even don't think that they need to supplement or take supplements. We think, oh, I'm eating healthy, I don't need anything. But actually, the body, especially when you do blood tests, might show a totally different story. And might affect their, life. That's amazing to hear all those stories. And obviously, when I contacted you, it was really nice that you offered to go through the same process as your clients go. So I went through the same process as all Michael's clients go. He signed me up, did the blood tests. Obviously, your company is body mapping, isn't it?
Correct.
Bodymapping.com.
Yeah.
So
It's
I was
actually
signed. Yeah.
it's bodymappingclinic.com, but yeah.
Okay, so bodymappingclinic.com.
Yeah.
So I signed up as a client. I could see on when I signed up a lot of, I could put the data in there and obviously get from putting the data in, I can get the data out, what's happening with me and on all
Yes.
what I need to do and so on. So obviously I did the blood tests. So if you could, Michael, go through what's happening, what you found out, and what you advised. And obviously, I train a lot as an athlete. I spend a lot of hours. So yeah, just if you could go through.
Sure. Yeah. So if people check out the website, you can see some of the testing we do, and we basically offer two key blood tests. One is a primary markers, and one are advanced markers. Most people have the two sets as a first off.
Yeah.
So that's what we did for you. It covers about 50 individual tests, so it's quite in depth. And then we put some of those tests through a calculator called bloodsmart.ai. So it's a sort of machine learning, artificial intelligence summary of your results, and which I found very useful. And that's designed by a chap called Christopher Kelly. Nourish, Balance, Thrive, runs the podcast. If you Google that, it's lots of information for athletes mainly. So I very much appreciate what Nourish, Balance, Thrive have created in this tool. And this is what we put your results through, didn't we, Rita? And last week, we spent probably an hour and 20 minutes going through them in some detail. And what we decided, obviously we don't have an hour and 20 minutes just to repeat that here, but we just drew out, so we just thought there's a few areas that were really useful to talk about.
So is it worth mentioning before you go through the results what I actually did before?
Yeah, do that, because I think that's important.
Okay, so before I did the blood results, I wasn't feeling very well. I was coming with a cold or something, and a week before was my throat sore and so on. I didn't feel unwell, but I still trained. Friday didn't train, but on Saturday I did have a competition, a weightlifting competition, where I lifted quite a lot of weight, snatches. The max weight I lifted 75 kilos. Then I did clean and jerks, which I went up to 100 kilograms. So it's a lot of weights moved on that day. Came back home, obviously that day was okay. My throat was hoarse and I wasn't feeling unwell though. On Sunday, I rested, didn't do anything, just spent at home. No, actually, I went for a walk. It was probably 3-4 miles walk as well on Sunday. On Monday, I didn't train. On Tuesday, I trained, probably not to my normal levels how I trained, but I did a little bit of training, an hour and a bit, maybe some light cardio. And on Wednesday afternoon at 1 p.m., my blood was taken. So, and that's the results now we're going to discuss. So I still was training, even I was feeling unwell a little bit.
So I've picked some kind of slides, which I'll look at in a second. But I think, so what I always say is the context for the blood test is important. So, and again, you can go online and buy your own blood tests. You'd struggle to get them for less than what we charge. So we're pretty competitive for the actual cost, but you can go and buy, there's various companies offering direct to consumer. But I think what's important is the context of, to understand those blood tests and what they mean, you have to understand the environment the patient, the client had the blood tests in, what's going on in their lives, some of the history behind that. And that's where the blood test plus the history and the description, if you like, and the context gives us the full result, and actually gives a meaningful result which we can do something about. So I think one of the things on there which we'll kind of go over, but I think affected your results was we talked about you probably could do with drinking a little bit more fluid. So one of the things, you're slightly dehydrated.
Yeah.
We talked about, because you're not keen on water, but one of your electrolytes were very good, and you explained that you do supplement with electrolytes, which is really important, particularly if you're on a lower carbohydrate diet, or you're sort of more so I said to you, just maybe a little bit more fluid in the day.
Yeah.
But we agreed you're traveling to a clinic to have a blood test, and you don't want to use the toilet, so you're possibly not going to be drinking lots and lots and lots. So I have to remind clients, make sure you're reasonably well hydrated on the day of the blood test. The other thing, some of your liver function tests were a little bit up, and we think that was probably because of the level of training that you were doing the 2 or 3 days beforehand. It seems to put something called AST and ALT up. They certainly weren't in anywhere near something that we would consider as abnormal, but they were slightly raised. And your gamma GT, which is another liver function, was absolutely perfect. So there was so I wasn't considered. So because I've got 3 or 4 markers that look at liver health, we can say, well, 2 are fine, 2 are up. Why could those 2 be up? Do you drink alcohol? No, not much. Are you overweight? No. So it's unlikely to be. It's probably related to the training. So, and I think the context of your blood test, your body was under stress. The stress from the training, and the stress probably from the cold you were sort of fighting. And I think sometimes we see stress as a negative thing, something we must avoid at all costs. Whereas actually stress can be, we need some level of good stress in our life to actually respond to and create traction, and human beings, we're good at responding to challenges if we're given the resources to actually meet those challenges. And I think it's interesting, isn't it, in those people's 3 case histories, we haven't taken away the challenges in their lives. We've actually equipped them to meet those challenges. The stress that they're facing hasn't changed, if you like, but they're better equipped to deal with them. And I think you clearly feel well, you're performing well, you're training well. So that level of stress that you're putting your body under, you're matching. And so I wouldn't say to you, oh my goodness, your liver functions, looks it's top end of normal, you need to pull back on your training. It's like, we can explain that, and the explanation is a good explanation, carry on. So, but it might be interesting next time to maybe have, like, I know you normally do 2 rest days a week, actually have if you can fit in, have a 3-day rest day. If we do repeat the blood test, have 3 days of rest before we do the blood test, because it would be interesting to see if they come down. And then if they do, then our theory, our hypothesis that it was the training is probably right. If they've doubled and you haven't trained, then that's a problem. And we're talking about pathology, what's going on with the liver, we need to look at that. So, and when we repeat blood tests for people, we don't just double the information, we kind of, the gain of the extra repeated blood test, the comparison is even more valuable. So the more, so we start to sort of it's like compound interest, isn't it? If you keep repeating something, the information becomes more valuable. So I think your blood test did show that you are under physiological stress. So, and one of the white cells and the neutrophils, which we look at, certainly reflected that. And I've got some slides with those on. So, and let me just bring those up, and should we attempt to screen share? So I've got them on, so hopefully we won't have too much. It'll be pretty clear for people to see. I guess if there is a technical issue, your guys can sort of, if I send the files, they can make sure that people can see these. What I'll do is I've got them all prepared. We just open the file. There we go. So let me just try. I don't know. The only thing is whether I can. Oh yes, you've got a share.
I've done that. You can share.
Excellent, fantastic. That's great. So yeah, so the context of your blood test. Let me share screen. Here we go. So preview. There we go. Can you see that?
Yeah.
Is that big enough? Do we think?
Yeah, it's good.
There we go, even better. So I'll come back to this. So the context of your blood test, I think you were fighting a cold, you were quite stressed, good stress from the training, and we'll come back to that at the end. But so I've chosen about, I think, 9 slides, just to kind of go over. So for people to see. So when we do these 2 blood tests, we send it off and we get a report back. And these slides are what people will see in the report. So one of the first things, your average sugar levels. We look at metabolic health, which is how the body deals with sugar. Are you at risk of diabetes? Are you pre-diabetic? And one of the common marker for diagnosis of diabetes is sugar levels, and your average sugar level, this thing called glycolated hemoglobin, or HbA1c, was absolutely bang on perfect. So excellent. This is exactly where it needs to be. And this tells me a lot about, your diet and training and nutrition is pretty spot on. So very good. Well done. Excellent. And then we also, one of the things that we noticed was your calcium was a little bit on the low side. So we talked about the fact you don't have a lot of calcium in your diet, but also one of the things is your vitamin D levels were okay, but they were below 100, and we really want them to be sort of above 125, around 150. Yeah. So I have shared. Have you seen your supplement prescription? Did you see that I have?
Yeah.
So I've put some vitamin D there on. So I don't think you certainly don't need to take calcium supplements. We wouldn't advise that, but certainly a little bit more calcium in the diet and increase the vitamin D. And the thing is, you're already taking vitamin D supplements. Is that right?
Yeah, correct. Yeah.
So this is, again, the value of testing. Your levels are pretty good, but they could be a little bit better. And testing tells us that, whereas otherwise we're just guessing. So, and then I think the most interesting thing about all your blood tests was that you are iron deficient, which we spent quite a lot of time talking about. So when we test for iron, we do several markers in the blood to try and build up a picture of where you're at with your sort of iron, your nutritional status. So one thing is, so your actual level of iron in the blood was right down rock bottom. So very little iron, free iron in the blood. So iron it's a very reactive element, and because of that, it's mainly bound to protein in the blood, and the protein carries it around. Otherwise, it would oxidize and turn to rust, like your car does on the drive if you leave it too long. Well, my car does. And then another thing we look at is ferritin. So ferritin is a protein. It's the main protein that binds iron. And again, right down in the red rock bottom, there's some really pretty good evidence, unless your ferritin is above 50, that you can have cognitive tiredness and feel tired. And clearly you don't. So so obviously your exercise and your training is kind of making up for the fact that you're low in iron. And what I'd be really interested is if we can get your iron levels and your ferritin particularly up and towards 100, whether you're lifting and your performance and what you notice. You may notice a little bit, you may not. I don't know. Unless we, but it'd be
definitely something to,
it
absolutely. Would be interesting to look at.
So another thing is we look at iron, so total iron binding capacity. So this is like free seats on the bus. So your body is your iron is being transported in your blood, and the question is how much. If you've got lots of capacity to transport more iron, that means you're short of iron. So if you imagine an empty bus with 2 passengers on it, then the bus company going, we've got much more capacity, we need more passengers. So you've got lots of capacity here, so you need more iron. So this is, again, heading towards the red. And finally, transfer and saturation. This is how saturated your transferrin, which is another protein that carries iron, how much iron it's got. And your result is is unrecordable. So the package, the dashboard, if you like, the bloodsmart.ai gives us a prediction of whether it thinks you're iron deficient or not. And you can see here that it's 100% certain that you're iron deficient, and I would agree with it. Yeah. Possibly some other deficiencies there, which we didn't measure, but might be there. And that's where a good multivitamin probably will cover that.
Yeah.
So yes, so iron deficient, and we wouldn't know that. And of the clients that we talked about, the case studies, if you like, the sort of the first lady, she was not quite as iron deficient as you, but getting her iron back to a normal level was a key part in her sort of recovery, I think. Whereas the other two weren't, and it's difficult unless you actually do the testing. You don't know.
That's right. Yeah.
What's going on. And then I've just chosen this slide here, which is it's probably a measure that people haven't heard of a lot, but it is related to nutritional sort of deficiencies to the red blood cells. And it might be that if we did a very expensive test for all your B vitamins and your zinc, and we might find some other deficiencies there. But I don't like spending my clients' money if I don't have to. So I would rather than spend a bit of money on a good quality supplement and see whether these things improve. So it'd be interesting to track this. And if we correct your iron, I'm pretty certain I could be proven wrong, but I think this will sink back nicely into the sort of normal level.
Yeah.
And then coming back to this, we talked about the stress sort of scenario. We do a measurement of neutrophils and lymphocytes, a ratio of them. And you can see here, I think you're the first client to be in the red. And I think that's because of the training you're doing. And this is, physiological stress. You're putting your body under stress. And it might also be that, your body is fighting this viral sort of cough and cold you had at the time. And the great thing is, when we are under stress, our body is active and looking for infections to fight, if you like. So the fact you didn't go on and develop a pneumonia and you kind of bounce back, carried on training is excellent, isn't it? Because your function has continued. So whatever, yes, you had a cold, yes, this is a bit raised, but actually you're functioning really well. So your body is responding to the stress correctly as you put underneath, you put on it. So this kind of this pattern fits the story that you told me. And that's what I think the fascination of actually working with the client. So because sometimes people contact me and say, I just want some blood tests done. I say, you can, but I think you're missing. I get upset when people don't want to talk to me about their results, because I don't want to be a blood testing service. I want to be a sort of much more comprehensive. And actually, the blood tests on their own are a bit dull. But actually, when you hear the story that goes behind them, I can now picture, you had this training, you did these lifts, and then you got a cold, but you pushed on through, and we did your blood tests. And so it all becomes a story that I'm interested in. And I've got this unique window onto your physiology. And that to me is the sort of true engineering, isn't it? It's understanding how Ruta's body is working to perform and function as she wants it, and how can I add a little bit to just help her improve that a little bit better. And that's where I sort of fit in, and that's for me where the engineering plus the functional medicine, the sort of root cause, the generalist is all comes together in this kind of really, really satisfying kind of solution for people.
Yeah, it's amazing. And I mean, it's really, thank you to you. I found out a lot of things which I need to work on, or take additional supplements as well, which I didn't feel anything wrong with me. And I would have never probably went and tested until I started feeling something. So it's definitely worth for everybody, even especially if you're not feeling well, have something going on with your body, go and test and tell the story. And I would suggest go to functional medicine doctor who will interpret those results and advise you in a nicer way, not to take probably some medicines, but take supplements or change a lifestyle or increase protein or something which needs to be done and will probably change your life completely. So probably we need to finish now. And what I would like to ask you, Michael, if people wanted to come to you, where could they find you?
Yeah, so come to my website, bodymappingclinic.com. It's not a perfect website, but it's got if you spend enough time on there, you'll get through most of the information and be informed as to what I do and how I do it. what I've found, after doing this for 4 or 5 years, what I find works best, and the way I've sort of structured the organization and the company and what we do, is we have a membership scheme where people pay £99 for 6 months. And that gives them access to all the technology. We haven't gone on about it today, but you basically get access to a health tracker data portal where you can upload as much data as you can, as you want.
Yeah.
So you can connect your Apple Health, you can connect your Garmin, your Fitbit, your Aura sleep ring. So you can put all your data there. I can share your blood results.
Yeah.
So it's a really helpful piece of technology that you have access to for the 6 months that you're part of the subscription. You get a free 20-minute sort of onboarding call with me, where we kind of go over sort of some of the things you might be worried about, thinking about, some of your major hurdles, concerns, questions. And from that, we will then arrange a blood testing. The prices are on the website for that. It's kind of pay as you go. So you could just join the health track and have a 20-minute chat, but that would be it. So if you want the blood testing, there's an extra cost to that, which covers the cost of the blood testing and the blood draw.
Yeah.
And then most people will then have a consultation after that with myself for 40 minutes, an hour, which again is pay as you go, where we kind of go over the results. And then I tend to provide and formulate a plan for what people, a brief plan with what people need to do in terms of their nutrition and exercise, which mainly is do more strength training, and what supplements they might need or don't need. And then that cycle repeats every 6 months until you feel that you don't need it anymore. Or so I've got some clients, who probably have the basic blood test once every 12 months, just as a check-in. And we meet up 20 minutes once every 6 months, and that's it. And they don't feel they need any more than that, until they hit a hurdle or a barrier or something happens and they want to sort of say, actually, this is happening. Can we do some testing around this?
Okay.
So it's all UK wide. So as long as you're in Scotland, Northern Ireland, or England, I think my insurance covers me for Australasia and everywhere apart from America.
Okay.
But I can't do the blood testing. That's the problem. So the blood testing is really UK based only, plus Northern Ireland.
Right. Okay.
Yeah.
All clear. Okay. So thank you very much for coming to the show, Michael. It's been a pleasure to have you, and good luck and thank you.
You're welcome. All right. Take care.
All right.
Bye now.
Bye.